Hi, everybody. Welcome to GW Center for Integrative Medicine YouTube cast. And I'm Dr. Mikhail Kogan, Misha Kogan, Medical Director, Associate Professor of Medicine at George Washington University. So today I wanted to talk about G6PD deficiency. We'll talk about what that means and how it relates to risk of COVID or severity of COVID. Rather, there's a new study that just came out in JAMA, but I also realized when I was reading the study and the review and med page, I realized that it's actually a really good, important topic. G6PD is, let me put it on a screen, jump right in. So G6PD is something called, the full term for this is glucose 6 phosphate dehydrogenase. Hold on a second. I need to get a full name of this because we always go, dehydrogenase, right? So glucose 6 phosphate dehydrogenase is a full name of enzyme. Of course, we always call it G6PD. And whenever we expose to oxidative stress, if we have this G6PD deficiency, what ends up happening is that this pathway of conversion of glutathione peroxidase doesn't work very well. And so the catalase cannot really effectively break down hydrogen peroxide to water. And when that happens, we can have increased risk of oxidative stress. And the most common condition related to G6PD deficiency is anemia, severe anemia. The thinking is that this condition evolved over many thousands of years as a defensive mechanism against certain illnesses. For example, malaria. So having the higher amount of hydrogen peroxide in certain cells that are infected with malaria could be protective. It could help you to kill the malaria infection. But of course, if you don't have it, but you have some other challenge and it leads to anemia, you may actually have more problems than benefits. So, okay, so this is the basics. So this is what it means. And one of the critical aspects of this is that G6PD test is extremely simple. It's like something like $5 at any lab, covered by every insurance for all kinds of indications. So it's very easy to know. And I actually do recommend that you understand and know your personal G6PD status. It's rarely changes throughout the life cycle, but it may. The labs do not test actual gene. They test expression. So they test for the level of the G6PD enzyme. And if you have it normal, you're done. Now, if you're deficient, basically you have to know. Okay, so why do you have to know? It's not only that it increases risk of anemia just because, but it tends to have a higher risk of certain complications of certain triggers. So we, in our clinic, often give patients with different conditions like cancer, for example, high dose intravenous vitamin C. And having G6PD deficiency is an absolute contraindication to the infusion because it can increase risk of anemia or hemolytic anemia. So in this, I'm going to share you my other screen with you. And let's see. So, and in this study, this is the, so if you, I'll put this study in the chat. So this is where this thumbnail figure came that I just showed you, and I appreciate authors of this study for doing this, and I'll have that link. But what I want to talk today about in more detail is this recent news from this one from MedPage. MedPage is something I track daily. It's a wonderful news of medical quality medical information. So this is a large study that was published in JAMA. We'll jump to it right away. And basically it says for people who are 65 or less, particularly for men who have G6PD deficiency, regardless of whether they're white or black, you have a significantly higher risk of severity of COVID. So let's look at the study. So the study was published in a Journal of American Medical Association in a network in open access. So of course, I will put the link to the study and you can see all of the study here. They took nearly 25,000 veterans and then they assessed their G6PD deficiency status. They found that about close to 10% of the veterans had it. Now that's interesting because in population that we work with, we see this a lot less commonly. I'm not exactly sure why that is. Generally, my sense of it was that the overall average population probably has closer to 1 or 2%. Because it's much more prevalent in blacks. Maybe that is why, because they probably had more blacks in the group of veterans altogether compared to the general public. I think that's the main reason. So what they did is, once they identified G6PD deficiency, then they went and they looked at the risk of severe COVID. And I'm just going to show you this table because this is probably the most important table. So the having G6PD deficiency increased crude risk. Crude means before they adjusted it to all kinds of variables. And adjusted risk in people under 65, for whites, it was 25% increased risk, and it was almost 50% increased risk in blacks. In whites who were over 65, that risk was more than 3 times, so more than 300%. For a very unclear reason to me, it appeared that it actually was, it wasn't protective, but there was no difference in blacks who were over 65. I find that hard to believe, because in reality, I was expecting even more harm here. So I don't understand this. There may be some bias. One of the problems with the non-controlled trials, you can have biases that are hard to explain. The study didn't go, I mean, they tried to explain this, but the explanation for this, it doesn't make a lot of sense to me. So I think the whole point here is not necessarily thinking that, okay, how do I take this to myself? The way to think about this, because how cheap the G6PD test is, and every doctor can order it from any lab in essence, and the fact that there probably is a true increased risk in a severity of COVID, you need to know your status. That's basically what it means. Now, let's talk about, okay, if you don't have G6PD deficiency, statistically speaking, most likely you don't, regardless of your ethnicity. But let's say you do, then what? Well, then you may want to be a bit more proactive about early onset of COVID. So, you may choose to be more vaccinated or more aggressively vaccinated. You also may want to choose to have your Paxlovid on hold, so to speak, at home, not in a pharmacy. So, usually problems always happen on Friday night when you can't access your physician. So it wouldn't be like, if you're my patient, I definitely would have you keep an order at home in case that you can't reach me or whatnot, that you can start taking as soon as you identify that you have a home test positive and your symptoms are consistent with COVID, then you should be taking it. And of course, general support as well, things that we've discussed for on multiple occasions before, including the zinc and acetylcysteine, vitamin C, and quercetin, and other really good things that can help you to combat COVID. So that's really brief. I think it's a very interesting study. All the links going to be in the video. I will also put the link to one of my prior videos that discusses the risk of or association between natural COVID infection and immunity for next several months, just so you have a context if you decide to change the way you're vaccinated against COVID. That article will give you some good ideas showing that actually natural immunity seems to be the best, so that you may take that into account. Thank you so much for watching. Have a wonderful day, and I'll see you back covering different health-related issues, particularly paying attention to new things and also things that you may not be aware of. Have a good day. Take care.